Hello again, everyone. Mark Hackle, Macomb County Executive. John Paul Rea, just giving you some updates of what's going on here in Macomb County dealing with this COVID crisis. I know we've kind of added a couple of features here to this website, but John Paul, where are we at with the numbers?
Mark, macombgov.org with our community dashboard, currently looking at just over 4,600 cases now in Macomb County. Unfortunately, 470 deaths. However, we've got a little bit of good news to report from our community dashboard. Using the new state standard from the Department of Health and Human Services, we're now recording COVID recoveries. Right now, just under 900 individuals that have been recovered from the COVID virus here in Macomb County.
Interesting enough, because that was a question that was asked a lot of us, is, what about the recoveries? Is there such a thing? And there was no national standard. So we turned to the state, found out, their health director is using a standard that I think we're going to follow and mirror. That's where we're taking a lot of our guidance from, is what's going on with the state. And that was basically the 30 days past, having tested positive. If they haven't passed away, they haven't died as a result of the COVID virus, they would then be looked at as being someone who is cleared or has recovered from that. And so, the number may not sound substantial, but it's kind of where we're headed as far as our direction on this.
Mark, you bring up an interesting point with regards to the numbers and, some of the shock as the daily figures come out. When we look at the state, just under 33,000 cases, now at 2,700 deaths. From a more macro perspective, when we look at where Southeast Michigan and Macomb County stands, across the country, 3,100 counties. Unfortunately, right now, Macomb County, we rank 34th in cases and 12th in deaths. Oakland's above us and Wayne is above us too, and also the city of Detroit. So still that concentration here in Southeast Michigan, still looking at those numbers day in, day out. We're going to see them increase. But again, through our coordinated effort here out of our Emergency Operations Center, we've been able to handle the surge and we've been able to respond to the community need.
And that is substantial when you stop and think about, not only how we rank, that's sometimes what people are like, what do those numbers really mean? But when you start looking at it from a ranking perspective, 3,100 counties in the entire country, and here we are 34th with the number of cases, and then I believe you said 16th overall as far as the
12th, excuse me, 12th in
12th
death.
Overall for deaths. I mean, that really kind of tells the story. And, yet knowing Oakland and Wayne County are even higher up on that list. That's the statement I think that was where we're looking at with as far as the state making a determination, what are we doing with the shelter in place, trying to keep people a distance from one another. They're making these decisions based upon the statistics, based upon the data and the facts, and we're not seeing anything as far as a downward trajectory just yet. That plateauing is where we're even hoping for right now.
I think plateau is the way to say it. Those numbers are going to be steady. Also, we're looking at what's going to happen here as we increase testing, as we look back at phasing back in our economy. These numbers are going to be quite volatile over the next few weeks, Mark. But what it boils down to is analyzing the data, the facts and figures, and then how are we going to ensure that we get the resources at the critical places to respond.
And make a determination whether we're coming back, as a state, when business is going to start moving back in. So those decisions are going to be made. They're made at the governor's level, and we're going to continue to monitor and follow that, work with our business sector. But let's face it, it's going to have an impact also on various other delivery of services, meaning the county, local units of government. How are they going to ramp back up and when they're going to come back to work? So we're watching all of that stuff as it plays out and trying to make a determination, how it's going to impact us. Even our financial situation here, the county's budget is somewhat of a concern, but we're trying to manage through that as well.
Mark, it's all about responding to the need of today. Currently, through our Emergency Operations Center, working with our health department and all our department leaders and countywide elected officials, I think we've answered the call. We've made those difficult managerial decisions right here in the interim, but as we're looking out to the rest of this budget cycle, it's ensuring we get those resources where they're most needed in the community and prepare ourselves for what comes next.
And some communities are already making that determination with layoffs because they're concerned about their current budget cycle. We're just working with our finance department, our human resources department, and trying to look at ourselves as an organization, whether it's our various departments and or the county-wides. We're fortunate. We've got our fiscal house in order here. We've been able to manage our affairs, knowing that we're even looking at a potential estimated shortfall of about $9.5 million. Some of the things that we put in place early on, trying to figure out how do we deal with the personnel, not backfilling some of the positions where people have retired. Overtime is significantly down. The numbers in the jail, 313 prisoners in a jail that once upon a time back when I was sheriff had over 1,400. So obviously the services that support that aren't needed as much. And so with that, well, we're looking at possibly, the upside to that is about a $10.5 million swing. So we're going to balance ourselves out. We're going to be okay as far as our year 2020 fiscal budget. We may not have to deal with layoffs during this budget cycle, but the concern is where are we headed in 2021? And that's going to be an unbelievable challenge for every unit of government, local, county, state, and even at the federal level.
Mark, across the board, not only from the executive's office, countywide directors, we've made those prudent decisions financially and operationally. It's put us in a favorable position to respond to the coronavirus challenge that we're faced with here today. Now it's looking out more long term. How do we continue to respond? How do we hold back that surge? And whether it's a challenge that it's going to be on the community side or the healthcare side, how we can work those resources to where they're most needed across the county.
And it's going to change a lot, even the service delivery, not only from the educational component, how they're delivering service, what many companies are going to be doing, but even as a government. You stop and think about 911, that tragic situation, that kind of came here to our homeland when we were attacked as a result of the 911 incident. It changed everything as far as security, whether it's in schools, whether it's the airports, even government facilities. So this crisis, this pandemic, if you will, this health concern that we're seeing is without question going to be something that's going to change what we do and how we operate, even as a county, as far as a government. And with that, we got to start thinking about how do we deliver services differently, and that's something we're going to be working on with our countywides and our department heads.
And Mark, just like back on 9/11, there was an influx of resources that came into locals to help them skill up, to help them get ready, whether it's from the public safety side, whether it's from the public health side. We're tracking all those pools of resources, whether at the state level or at the federal level. We're going to ensure that our county is in the best position not only to receive these resources, but make sure that they get to the most critical and essential need in our community when appropriate.
Yeah, that's a good point. There is federal dollars coming our way to support what we're doing currently, whether it's buying personal protection equipment, trying to help get food to people that are in need of the particular types of food they're going to have. You look at an organization or look at a facility like this, Comtech. This was built with a mindset, communications was key, was number one when we had this crisis with 911. We were able to put a facility like this together, upgrade our radio systems, and got an 800 megahertz interoperable communications because of that crisis and some funds that were available. Now with this particular crisis dealing with the healthcare, we're going to be able to upgrade facilities, whether it's like our health department, Macomb Community Action, additional support from emergency management. So those funds are going to not only help us with today's needs, but looking at how do we ramp ourselves up so that if there's a future pandemic or issues like that, we're going to be able to hit that as soon as we start to see that happening.
Strategically putting those resources in the best place to sustain our response, but also make sure we're building and investing in our future.
Yes. So again, MacombGov.org for current updates and information. We did add the new feature, as John Paul just got through mentioning, talking about recoveries from this COVID crisis. But we want to remind you once again, thank you for joining us, but also keep yourself and your family healthy.